Good morning, class. So today's lecture will be on the bladder meridian. So the full name of this meridian is the bladder meridian of the foot taiyang. And because it's a foot taiyang meridian, what we know is that it's going to run from the head all the way down to the feet. This meridian has 67 points in total, and the common indications between points are for disorders of the head, the nape, the eyes, and the lumbosacral region. It can also be used for disorders of the rectum, mental disorders, and then because all the back shoe points lie on the bladder meridian, the bladder meridian has a much larger range of indication, as each back shoe point can be used to treat its corresponding organ's disorder. So for instance, the back shoe of the kidney can treat any disorders of the kidney zangfu organ, whereas the back shoe of the lungs can do the same for the lungs. And then finally, it can be used for any other regional diseases, and what this refers to is any disorders along the pathway of the flow of the meridian. Now let's look at the actual course of the meridian. So this meridian starts at the inner canthus of the eye at bladder 1, which is this region here on the image. And then what it does is it ascends to the forehead, where it joins the due meridian at the vertex. Two branches occur here. The main branch enters the brain and then continues descending down the back of the head to the neck. And at the neck, it bifurcates to descend along the posterior aspect of the back. So the bifurcation is over here. At this point here, you can see it splits into two different pathways. And now we're going to follow just the medial pathway. And this pathway continues descending along the back, and it runs medial to the scapula and parallel to the vertebral column, but 1.5 tsun lateral to it. So if this was the vertebral column here, the distance between these 2 points is 1.5 tsun. And then from the upper back, it continues down to the lumbar region, where it connects to the kidneys. So you can see over here, it enters interiorly and connects to the kidneys. This is its associated zang organ. And then it also connects to the bladder, its own organ, down here. And then it continues flowing through the lumbar region over here, down to the gluteal region. In the gluteal region, it descends all the way down to near the coccyx region, where it then loops back upwards and medially and continues descending once again, all the way down to the coccyx region again. Once it gets near the coccyx region, it moves laterally to the gluteal folds and then descends along the posterior aspect of the thigh all the way down to the popliteal crease, where it joins the lateral branch at bladder 40. And this is bladder 40 over here. Now we're going to look at that lateral branch here up at the neck. So if we follow the lateral branch, it runs down the neck and then runs straight down the medial border of the scapula. So if the scapula was like this, it's going to be running down its medial border, and it's going to continue down the medial border, and it's going to run parallel to the spinal column, but 3 tsun lateral to it. So that's double the distance from the spinal cord to the medial pathway of the meridian. And then it will continue descending 3 tsun lateral to the spinal column all the way down to the lumbar region, and then down to the gluteal region. And in the gluteal region, it will then move laterally, just like the medial pathway, and then it will continue descending along the posterior aspect of the thigh and connect to the medial branch of the meridian at bladder 40, which was over here. From the popliteal fossa, the meridian continues descending down the gastrocnemius muscle, and then it moves slightly laterally, that's at this region here, and then continues descending along the posterior and lateral aspect of the lateral malleolus over here. From here, it will continue along the lateral aspect of the foot all the way to the tip of the little toe, which is bladder 67, and that's where it links to the kidney meridian. Now let's look at the major branches. So there are 3 branches that occur. Firstly, the vertex branch, which we talked about. What this branch does is that at the vertex, it emerges and runs to the temple region. So you can see it's this blue dotted line in the image. merges at the vertex and runs to around this temple region. And then we also have the medial and lateral branches, which we talked about here at the back of the neck. The medial branch, which runs 1.5 tsun lateral to the spinal cord, and the lateral branch, which runs 3 tsun lateral to the spinal cord. And then finally, the lumbar branch, which is that branch of the medial pathway, which connects to both the kidneys and then goes all the way down to the bladder. Now let's look at the frequently used points. So what you can see is there's actually quite a few frequently used points on this meridian. And the reason why is because a whole lot of these points are back shu points. And this means that they'll be used much more often as they can treat the associated organ. So if we look at the points from bladder 13 all the way to bladder 25, all of these points are back shus except for bladder 17, which is the Hui meeting point of the blood. So that's one reason why there's so many points. But some of the other points that are important, that which aren't back shu points, are points such as Jingming, bladder 1, Chuanzhu, bladder 2. Both of these are located on the eye region. Then Tianzhu, bladder 10, Daju, and Fengmen. These three are located on the back of the neck and upper back regions. And then if we go all the way to the other side, we can see Chengfu, bladder 36, Weizhong, bladder 40, Jibian, bladder 54, Chengshan. These four here are located on the posterior gluteal region, the posterior thigh, and calf. And then the final two, Kunlun and Jijin, are both located on the foot. So the first point in this meridian is Jingming, bladder 1. This was a frequently used point we just talked about. And this point is located 0.1 tsun superior to the inner canthus of the eye, near the medial border of the orbit. And when they say the orbit, they're referring to this bone here that runs the whole way around the eyeball. So what we want to do is we want to be near its medial border. So when we're needling this point, we want to make sure we're right close to this border here. We don't want to be close to the eyeball over here, as this would increase our risk of puncturing the eye. And then the indications for this point. So this point can be used locally for redness, swelling, and pain of the eye. It can also be used for itching of the canthus, lacrimation disorders, night blindness, color blindness, and blurring of vision, and finally for myopia. Then it can also be used for conditions along this meridian, such as acute lower back spasms or pain, and it can be used for palpitations. And this point has a special needling technique. What we do is we have to ask the patient to close their eyes. Then we will place the thumb of the palpating hand over the eyeball so that we can correctly identify the eyeball's location. And then when we insert the needle, we must ensure that the needle is running along the orbital wall, and we insert about 0.3 to 0.7 tsun. And there are quite a few cautions here. Firstly, it's not advisable to do excessive lifting and thrusting manipulation here, as there are many veins and arteries in this region, and this will increase the likelihood of us damaging one of these vessels. Secondly, whenever you remove the needle from this point, you must press the point for a few seconds after withdrawal, as this will reduce the risk of any bleeding and any bruising on the face. And then finally, this point is contraindicated for moxibustion. Our next point is Chuanzhu, bladder 2. This point is located on the medial extremity of the eyebrow, in the depression directly above the inner canthus. So here's the inner canthus of the eye. We're going to go directly above that, and we're going to look for the medial end of the eyebrow around here. This point can be used for headache, redness, swelling, and pain of the eye, blurred vision, lacrimation disorders, twitching of the eye, and glaucoma. It can also be used for pain of the supraorbital region, which is this region here. Our needling technique is a horizontal insertion, 0.3 to 0.5 tsun. And what we do is we can go towards Yu Yao, this point here. So we needle in this direction. Or we can prick this point to cause bleeding. So the next point we'll be looking at is bladder 3, Mai Chong. This point is located directly above the medial end of the eyebrow, bladder 2, also known as Zanju, and it's 0.5 tsun within the hairline, level with Do 24. So if we look at the image here, here's the anterior hairline. So we've got to be 0.5 tsun into this, which puts us in this line here. And then we've got to be directly above bladder 2. So we go from the medial end of the eyebrow and we go directly upwards until these two lines meet. And that's bladder 3. This point can be used for headaches, dizziness, epilepsy, and nasal obstructions. Our insertion is a horizontal insertion, 0.5 to 1 tsun.